Hi, everybody. Welcome to Social Work 5100 Coffee Talk or Tea Time with Dr. Collins. Today we have Professor Ostrowski here with us to talk to us a little bit about trauma. So, Professor Ostrowski, could you start by introducing yourself?
Sure. Thanks for having me, Dr. Collins. My name is Professor Nicole Ostrowski. I'm currently the BSW Program Director at Concordia, but prior to that, I worked for almost 20 years in Milwaukee County's child welfare system. During my time there, I spent a lot of focused attention on trauma and teaching Milwaukee County community, foster parents, adoptive parents, birth parents about the impacts of trauma.
Thank you. Could you start just by telling us a little bit about, what is trauma?
Yeah,
Students hear
it's
about it all the time. It's become so common. And so can you just give us a little bit of a breakdown, a
sure.
cheat sheet,
Yeah,
if you will?
definitely. It's really interesting because the word trauma has been overused, misused so much in the last 10 years. It's good we're talking about it more, but it's really important to have a solid definition of trauma before you start kind of throwing the word out there. There are a lot of definitions of trauma too, and that's what makes this tricky. If you Googled it right now, you'd probably find 25 different definitions. But there's one definition that I really like. I think it incorporates what we're really talking about when we're discussing trauma. And it's got three different parts to that definition. So the first part is that there's an exposure to an event, and that event threatens or it harms the physical or emotional integrity of the individual or someone close to that individual.
Mhm.
And the second part is that that exposure to that event overwhelms the person's ability to respond and to cope. And then the third part is that that kind of overwhelm ultimately creates significant difficulty in that person's functioning.
Great, thank you. That was really comprehensive. And can you tell us a little bit about any tips, tricks, just application strategies that students could use when they're out in the field working with the people they serve?
Sure. So, anytime you go through a trauma informed care curriculum, training, certificate program, you're going to hear this thing called the 4 R's of trauma informed care. And it's a nice, easy framework to really think about how to do this, how to apply this well. So, the first R in trauma informed care is to realize. So, it's about realizing the widespread impact of trauma and understanding that there are so many paths to receive or to experience trauma, but there's also a lot of different paths for recovery. So the first is kind of realizing. The second one is called recognize. So we got realize, then recognize. Recognize is about really looking at the signs and the symptoms of trauma in individuals, clients, families, staff maybe that you're working with, systems, right? So recognizing that there are a lot of signs and symptoms that you see throughout all the different kind of levels, and recognizing that it impacts everyone and every system a little bit differently. And it can
So
do
there's
this
not
in
a one size fits all for trauma.
there is not, absolutely
Okay.
not, because it affects things like worldview. It affects things like
Mhm.
feeling vulnerable or helpless or afraid, but it also interferes with things like relationships or fundamental beliefs about oneself, about others, about one's place kind of in the world. And so recognizing that the symptoms and signs are vast. And so you're not going to have an easy checklist of what trauma is doing to each individual. The third one is about responding. So when you're responding, you've got to put this knowledge into practice. Because trauma informed care, it's really a change in perspective, right? It's not what's wrong with the person, but it's what happened to them, right? And that approach, it really does lessen the blame on the person who's experienced the trauma. And instead it makes it not their fault, right? And so it shifts this perspective for them, but it also shifts perspective for you and how you're going to respond to the person. And then the final 4 R of trauma informed care is resist re-traumatization.
Right.
So trauma informed care, it takes every step possible to kind of minimize situations that could cause further distress. or mirror any of the person's traumatic experiences. We've got to let people know that they are safe in our presence, and that's something you have to earn. That's not something you can just tell them. But any step you can do to avoid re-traumatization is critical for being a trauma-informed practitioner.
Well, and that aligns so well with our code of ethics and our mantra as social workers to do no harm and to be really cognizant of how we are approaching situations, people's communities, individuals, families. Well,
Yeah,
thank you. The 4 R's. I think we have to remember everybody to take those away, the 4 R's when we're
yeah,
approaching. And, Professor Ostrowski made it clear, not just individuals, because communities experience trauma too. So when we're working with individuals, families, communities, organizations, be really mindful of the 4 R's that Professor Ostrowski mentioned today.
yeah. I would just say, just always keep in mind that trauma has a profound impact. And it's not just one layer, right? It's the brain, it's the body, it's the mind, even the soul, right? So we've got to really shift in our thinking to trauma is a super normal reaction to an abnormal event. And that's something
Absolutely.
that we've got to keep in mind. So the last thing I would say as you walk away today is don't forget to look at a situation and think, what happened here, right? You approach it with curiosity and not judgment, and that'll get you pretty far.
And I'm going to end by reinforcing that. Make sure when you're looking at something, you're framing it as what happened here. Thank you so much. I don't want to say much more. I want to wrap up here. Happy coffee talk with Dr. Collins, tea time. It's been great. Thanks so much for your time, Professor Ostrowski.
Thank you.